While many people are limiting the number of places they go, there's one that may save your life, your doctor's office. By putting off preventative care and even ignoring symptoms of something serious, many people are putting their health at risk in a very different way. Dr. Khurram Ahmad of Texas Health Physicians Groups joins us. Good morning, doctor.
Good morning.
All right, so is fear of going into a hospital or a doctor's office keeping people from getting care? I would imagine it would be.
So, unfortunately, yes. For example, the CDC's morbidity and mortality weekly report suggested that ER visits in April were down 42% across the country as compared to the same period last year. We also hear it anecdotally from others in the medical community. People's concerns are different. Some people think they don't want to be potentially exposed to a virus by leaving their house. Others feel that they don't want to take time away from people who may need medical care. But that is what we are here for, and by not getting the care you need, you put your health in a dangerous position.
All right, because we know that preventative care is so important, but what are some of the issues you see with delaying things like checkups, for example?
So that's a good question. Delaying care because of fears of COVID-19 can lead to long-term health consequences. Skipping appointments or not being diligent with your cardiac care can result in long-term health issues, including heart attack, stroke, and heart damage. A delayed presentation of a heart attack may lead to complications which may require surgical repair for management rather than a simple stent procedure. So getting well visits and screenings can identify risk factors and help manage them.
Well, it certainly is alarming that people are ignoring symptoms that could be associated with a heart attack. What would you say are common symptoms of a heart attack that people should be aware of so that they can take immediate action?
So the most common symptoms we have for heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest lasting more than a few minutes. It may go away and then return. It can feel like uncomfortable pressure, burning, squeezing, fullness, or pain. Discomfort can also happen in other parts of the body, like one or both arms, mostly in the left side, back, neck, jaw, or stomach. Other possible signs include breaking out in cold sweat, nausea, or lightheadedness. Now, women's most common heart attack symptom is chest pain, and some women are more likely to experience shortness of breath, nausea, vomiting, and back or jaw pain.
Right, and women are just as susceptible to heart attacks as men, so it's important to be aware of those symptoms. So what are you telling your family, friends, and patients about getting cardiac care during this pandemic?
So get your regular checkup. Make healthy lifestyle choices. Get your exercise, eat well, get sleep, manage your stress levels. Know your risk factors like high blood pressure, diabetes, tobacco abuse, high cholesterol, sleep apnea. See your primary care doctor. So the truth is that medical community is hoping that our patients take heed and understand that a big danger of this pandemic could be people putting off their preventive care that we know saves lives. I want to mention one more thing, that American Heart Association has a wonderful message. I like to hear that. Don't die of doubt. This campaign reminds Americans that the hospital remains the safest place to be if they experience symptoms of heart attack or a stroke.
Those are wonderful and informative tips. Thank you so much for joining us, and stay safe and healthy.
My pleasure. Thank you.
All right. So call 866-767-9165 for more information, or go to thpg.org/heart checkup. As a